Thank you. For the debate. The member from Oshawa.
Thank you very much, Speaker. Right now, my community is facing a crisis of mental health, addictions, and homelessness. And my office works with unsheltered and underserved constituents, and I recognize just how impossible it is for many in the community to navigate healthcare and support systems while struggling with addictions and mental health issues. For some people, it's nearly impossible to survive. I've been glad to work alongside the Backdoor Mission, which is a centre of care and service without equal in the province. Please understand, many of the vulnerable clients that they work with that are served at the Backdoor Mission, they can't access appropriate care elsewhere. More than 50% of them don't have health cards. They can't be served by a private clinic. They need the help and the care of a place like the Backdoor Mission, who sees people who have little or no income with no place to stay, who require just treatment and medicinal support for their mental health and their medical needs. They also need a place to stay. They need nurses who have the time to show them that they matter and are cared for, case managers who provide empathy and understanding, and volunteers and peers who make them feel protected as a part of the community, and they get that at the Backdoor Mission. And at the Mission United Hub in Oshawa, this model of care happens every day. It's practiced every day, and it does so because of the commitments of CMHA. At the beginning of the pandemic, other people shut their doors, but CMHA Durham found a way. They partnered with the Backdoor Mission, which at that time was just, I won't say just a local charity, but was a local charity providing food and respite. And now, almost 3 years later, they're operating a high-functioning clinic for homeless individuals, literally keeping people alive on a daily basis. I appreciate the work of everybody connected to this project and across communities, and I talked to Nathan Gardner, the Executive Director at the Backdoor Mission, and he wanted me to share this when I told him that we were asking for funding for CMHA and to do the work that is so required across our communities. And he said, it's clear what is needed to support programs like Mission United and organizations like CMHA Durham is more funds to make sure employees have consistent access to training, respite, and resources to support them, more people, more workers with specialization in mental health and addictions to ensure that they do not have to handle this on their own. People we serve who suffer from mental illness are some of the most complex and misunderstood we see today. They require a commitment of our respect and dignity. Therefore, it's absolutely crucial we support those who work with them every day and show them the same respect." End quote. Government, support this motion. Increase CMHA funding today to support our neighbours in need. Thank you.